and welcome to our today's webinar. I am Andy Dwyer, and on behalf of the Patient Navigation Community Health Worker and Promotor de Salud Alliance, I want to welcome you all to the second in our series of 6 dedicated to transportation, housing, as well as other practical barrier reduction and looking at solution to barrier reductions for navigation, for navigators, community health workers, Promotores de Salud, and many folks working in the care coordination field. So we're really excited to have you. We are working with the Patient Navigation Training Collaborative, as well as with funding from the Colorado Health Foundation to support this work. So we're very excited. Again, we are working on a 6-part series through the next year. We will conclude in the summer next year. And this specific webinar is devoted towards non-emergent transportation and still addressing transportation barriers in Colorado. So we were really excited about the panel that we hosted about a month ago, and then there was a ton of requests for discussion around Medicaid, transport, as well as Medicare. So we had the opportunity today to work with Mallory and Ryan out of the healthcare HCPF, Healthcare Policy and Finance team, to talk a bit about the non-emergent medical transport benefit and how that specific benefit works for patients and for those of you working in care coordination. So I'm very excited to have the team. Just a quick reminder that today you are going to be on mute during most of the presentation, just to avoid background noise. And we are going to ultimately have the chat feature available, though, for you all to ask questions. And we'll probably go ahead and entertain most of those questions after the presentation today. So again, very excited. Brittany, I'm going to go ahead and have you share any information related to the tech support and anything folks should share or should do to address any tech issues during the presentation today.
Sure, absolutely. So my name is Brittany Wellens, and I work in partnership with the Patient Navigation Training Collaborative. And I'm going to put my email in the chat, so if you are unable to hear anything, like Razalo seems to be having the issue with, you can shoot me an email and we can try to get your tech support kind of figured out on the back end so we don't interrupt the webinar. Otherwise, please just stay muted. I see a couple of you guys have sticky notes over your cameras, which is totally fine. If instead you just want to turn your camera completely off, so you don't have to have a sticky note on your monitor, in the lower right, or excuse me, lower left-hand corner of your Zoom window, there is a stop video button that you can press, and that will turn your video off completely so that you don't have to use a sticky note. So again, my name is Brittany Wellens. I'll put my email in the chat, and enjoy the webinar.
Excellent. And a huge thank you to Brittany, who's always been great support for our team. And she's always doing great things behind the scenes. So thanks, Brittany, for all the support today. So I'm going to go ahead and turn it over to Ryan and to Mallory, who will be our guest presenters today, to introduce themselves and talk about framing the issue, and we'll get into the discussion. And just quickly, I know we had over 100 folks last time. And people got locked out when we hit that 100-person threshold. So my apologies. We didn't quite understand that the link had gone out without the registration component, but we have now have the technology. I think, Brittany, we have a couple of 100 lines open. So invite all your friends to the series going forward. And unless we get basically 500 people on, we won't have any lockouts. So apologies if that happened last time, but again, spread the good word. So Mallory and Ryan, I'll go ahead and turn it over to you guys.
Great, thanks so much. You can go to the next slide. So just quickly, this is our mission statement that we always present as the department: improving healthcare access and outcomes for the people that we serve while demonstrating sound stewardship of financial resources. Next slide. So basically, we are going to provide an overview today of the non-emergent medical transportation benefit that is provided to Medicaid members, as well as kind of discuss the future of NEMT. We have a lot of changes coming up, some great budget requests that got approved, as well as legislation, and then open it up a little bit for Q&A and dialogue to hopefully answer some of your questions. Next slide. So to introduce ourselves, we both are new to the NEMT benefit. Some of you may recall working with Elizabeth Riekers-Ventino, who used to oversee this benefit. Our predecessors definitely laid a great foundation for us to be able to really improve this program going forward, and we're really happy to inherit the work that's been done. My name is Mallory Sear, and I'm a Transportation Policy Specialist here at the Department of Healthcare Policy and Financing. Previously, I worked at the Department for Public Health and Environment, and before that, I did health policy in Boston before I moved to Denver in 2015. I also have a lot of experience navigating transportation as well as other Medicaid systems in Denver and in other states as well. And I'll let my colleague Ryan introduce himself.
My name is Ryan Dwyer, and I oversee the NEMT benefits as well as the contracts here at the department. Like Mallory said, I'm pretty new. I've been doing this for about 4 months, but I've been with the department for about 1.5 years and was in procurement previously, working on getting contract solicitations, purchase orders, all that stuff done so that the department could provide programs and function. Prior to this, I worked on some political campaigns and have some additional policy experience, more education related to my time in law school, but so far I'm really enjoying overseeing NEMT, so I'm happy to present the info I have.
Next slide.
So this is just a general high-level overview of how we administer NEMT here in the state. It's operated under the Medicaid state plan, our agreement with CMS, and we operate a fee-for-service model statewide. Our transportation is only to and from covered Medicaid services, so this is a little bit different from the waiver benefit non-medical transportation, in that it doesn't provide access to the community as a whole, but does provide access to doctor's appointments, hospital visits, those sorts of things. Administration of NEMT is provided in 3 ways, one of which is county departments of human services, so places like El Paso County and some of the counties outside the metro area, they handle NEMT for now. A few regions do multi-county collaboratives, so a few counties will kind of band together to administer the benefit. And in the Denver metro area, we have a state contracted broker who credentials providers, schedules trips, makes sure that people are getting where they need to go. And that is currently VEO, and that will be changing in a few weeks here actually, which is something I will touch on in the next slide. And if you want to move on to that, I can keep going. So currently, like I said, our contract is with VEO, and some of you are probably familiar with them. We put out an RFP last year for a new contract for the broker model. We received 1 bid. VEO did not bid this time. The bid we got was from IntelliRide, which is a subsidiary of Transdev, a large international transportation company. We did receive a protest of the award and appeal, so some of you are a little confused about the timeline. The reason we're starting on September 1 is because of that protest and appeal, whereas we would ordinarily start a contract 7/1. We had to extend VEO for 2 more months to make sure there wasn't a gap in service. So IntelliRide will be our new broker, taking over for VEO starting. RIDE will start 9/1. IntelliRide's call center will open up on the 19th, so trips scheduled into September and beyond, IntelliRide is going to be able to help with starting on Monday. So we've been communicating with providers and facilities about this transition, and VEO and IntelliRide have been working on communications to members as well. So next slide, please. So I mentioned a little bit about the county departments of human services, and what we have discovered from talking with the counties that administer NEMT that are outside that 9-county metro area, and from talking with stakeholders and transportation providers, is that it's really difficult to have the counties operating kind of outside of any sort of in-place system in the state's overview. So we requested, and the legislature approved, financing for a regional statewide brokerage model. So we're still hammering out details of what that's going to look like, but it's going to be implemented somewhat along the regions that are in place for the raise. We were going to put out a competitive solicitation vendors can bid on one region, multiple regions if they have the capacity. I would imagine Untitled will probably put in for another region. And what that's going to do is it's ultimately going to expand the current 9-county broker model that we have here in Denver and the surrounding areas statewide. And then what that's going to do is it's going to take the lift of administering NEMT off of the counties. It's also going to give the state more oversight of administration and more uniformity in terms of state oversight. And it's going to be more uniform for members and providers too, knowing who they need to communicate with to schedule trips that are going to cross county lines, those sorts of things. That'll be effective. We'll have contracts in place July 1st, 2020. And the other exciting piece is that county administration funding will not decrease. So that county funding is going to stay the same.
Okay, excellent. And so I'm getting just some folks that said that they're having some issues with choppy, with a bit of choppy connection. So just a quick reminder, and I don't know, Brittany, if we can go ahead and share if there's a telephone connection, we could probably share that number so that you can then mute your line and then join in by a phone, and that might just be a little bit better. Brittany, is there anything specific to tell folks?
Yeah, I will send, there's a join a meeting via audio piece that Zoom has, so I will send that link to everybody.
Okay, great.
Yeah, I just want to add, Andrea, it's actually a little bit choppy on the phone for us as well. When you were speaking, it was kind of cracking up a little bit.
Okay, so Brittany, oh, okay, great. Sorry about that, guys. So we'll do our best to troubleshoot that right now. It's coming clear, I think. Brittany, it's good for you, correct?
Yeah, it's good for me over PC.
Okay, we'll try to do any sort of other audio checks, but please feel free to send any other comments that you have about being able to hear as well, and we'll try to troubleshoot that real time. I know Brittany's sending out that information. So, okay, we will go ahead, and just a quick reminder, if you have questions, please go ahead and submit those in the chat as well, and we'll try to entertain those likely at the end just to make sure to get through the content. So moving ahead.
Great, thank you. So another benefit under NEMT that is currently in the implementation phase was administered under House Bill 181321, which was actually what I was hired to work on. And this is the urgent transportation benefit. And so this is a statewide benefit that the network will be managed by the by the broker. Although this is only the statewide piece that they'll do currently. And this allows medical facilities to schedule transportation directly with the providers versus going through the broker. So although the broker will be managing the network, they will not actually be scheduling the rides for this. So this is VAO credentialing providers and growing that network, and then working on policies and billing procedures for providers to be able to bill for those services. And under this benefit, the rides will still be to and from only Medicaid covered services. Next slide. So that's really what we have going on in the world of NEMT. I saw a few questions in the chat box, and we have quite a bit of time. So with that, we're happy to open it up to any questions or dialogue from anybody in the audience.
Okay, great. So thank you guys so much. And I just wanted to mention today, we will be actually entering into discussions with Medicare also about any covered benefit, but at this time we didn't have substantial information to share, and one of their team leads was out. So we are focusing on Medicaid today. We probably won't be going the full hour and 15 minutes, but we'll probably have time for 30 to 45 minutes today. So you guys are gonna get some of your time back today, but let's go ahead and start with the questions. So there was there's a question right now that says, how do you define urgent transportation request? So urgent versus non-emergent, and is there a difference for this benefit?
Sure. So the urgent transportation benefit is identified as transportation with less than 48 hours notice. So for example, if a member is getting discharged from a hospital and they don't have transportation, or their transportation provider is a no-show, those instances where the medical facility would need to call the provider directly, or from the broker side, if a member was unable to give that advance notice, but it wouldn't exactly qualify as urgent. So for example, if you're sick and you need to go to urgent care, you wouldn't call an ambulance, but you also wouldn't wait 2 days to see if your strep throat or your pneumonia gets worse. So it's those trips that would not qualify for that advance notice.
Okay. So there's a question from Carrie, and I know there's a couple questions up further in the feed we'll get to as well, but is there a care coordinator who fields the NEMT request, or is this something we need to be responsible for the patients directly?
So here at the department, we don't have care coordinators that specifically focus on NEMT. Rides can be scheduled by the patient, by the provider. We work closely with the RAIs a lot for patients or members that are more medically complex, but that's not something that we have specifically at the department. We're heavily involved in requests that we get for or out-of-state transports. We work very closely with our clinical team to make sure those requests are approved in a timely manner. And then we involve whoever the member's case manager would be on our side. And under NMT, for members that are eligible for waiver services, they would work with the SEPs and CCDs around authorizing those services. But it would depend on the need and the benefit.
Okay, great. So a question from Kathy. I think it was around the language between a broker and sorry, we're getting a couple questions in, so I lost track here. The difference between a provider and a broker.
So the broker is basically, the difference is the broker is responsible for basically managing our network of providers. So the broker, Telluride or Veo, currently won't actually provide the trips, but what they will do is they will schedule the trips. They will get in touch with providers who are actually going to complete the trips, like Green Cab, for instance, and make sure that the trip is scheduled. They will handle complaints. They'll credential vehicles. And the other difference, I guess, is that they, like I said, they don't actually provide trips. It's going to be those providers like the AMRs or Green Cabs of the world that actually provide the trips. So, one providing the trips, that's the provider. The broker is just kind of managing the network and actually not providing any trips themselves.
Okay. So I think this actually goes back to that point that Telluride might not actually be located in a specific region. So Ryan, it sounds like you were saying that even if they don't have a hub in that certain area, they will arrange rides for people in areas. So I think the specific question that Bernadette had is in Pueblo, do you know who their service provider would be? And I think there's a couple questions also about in rural communities, would there still be access to this type of benefit?
So I don't know specifically who Pueblo uses to provide transportation. Scheduling trips and the like would be done by calling Pueblo County's DHS. Who the contact is there, unfortunately, I don't know, just because, like I touched on when talking about the budget request, we don't have a whole ton of oversight currently, counties that are outside of the metro area. So Pueblo County should just be a call to the Department of Human Services.
Okay. So the next question is, will there be a clearly defined list posted on a website about who qualifies and who doesn't for a ride? It just still seems a little subjective. So hoping that there can be some clarity. Is there a specific criteria punch list of eligibility?
Yeah, so anybody who is eligible for Medicaid state plan is eligible for NEMT services. So anybody on Medicaid is eligible for NEMT. The type of transportation they're eligible for will need to be coordinated with either the broker or the county, as well as the member's medical provider. So if they feel that there's a medical documentation as to why the member would need a private ambulatory, not an ambulance, but a driver to come and pick them up, even if they have public transit within a certain distance from that member, that would need to be provided in terms of why they're unable to use other forms of transportation. But in terms of eligibility, anybody who is on Medicaid state plan is eligible for non-emergent medical transportation.
Okay. So next question, and we'll just keep going in order, and I know that they're piling up. So what kind of language assistance or interpretation services are available through the line or through this specific benefit?
So the language requirements are outlined in the contract for the broker. Ryan is digging for that. We don't have it off the top of our head, but they are required to provide language services and interpretation as needed, and we do not know, I don't know off the top of my head what those languages are, but that's something that we are currently in discussions with and looking into, but it's outlined in the contract. In terms of the county level, once again, since we don't have oversight of that administration, I couldn't tell you that, but I would imagine that the DHS is required to provide that in terms of accessibility and interpretation.
Okay. So there's a couple questions just about quality and then accountability. One is in terms of, is there a contact at the state that if there have to be additional questions ongoing about this, who to contact? And on occasion, there's been, sounds like, conveying of incorrect information by brokers. What is the accountability?
Sure. So to answer the first part of the question, on the last slide of the PowerPoint, if you email nemt@state.co.us, we both have access to that inbox and will answer any inquiries that are sent there after the presentation. What was the second part of the question? I apologize.
And then if people are told, it sounds like, what is the accountability for brokers? If, you know, for instance, if they're giving misinformation from brokers, who should they contact about basically not getting quality information and people who are educated?
Yeah, so I would definitely use the NEMT inbox for any concerns about the broker. Again, we're transitioning as of 9/1, and so we're trying to make sure that all parties are giving out consistent information. We know that that is not always the case, so if you hear anything concerning from either VEO or especially in Telluride, since they'll be taking over as of 9/1, please reach out to the NEMT inbox and we will handle that and get back to you as soon as we can.
Okay. This one from Kathy, do we have to resubmit for patients that we have submitted with VEO previous or indefinite? Do you have to resubmit if they're already registered? It sounds like it's a question.
Would that be for trips that are scheduled in the future or for standing orders?
Ryan, can you just address both? It probably would be helpful.
Sure. So the way it's going to work now is that VEO is supposed to transfer everything that they have to Telluride, and that's going to include trips that are already scheduled for September and beyond, as well as any standing trips. So those shouldn't need to be resubmitted. Telluride is supposed to have access to all of that information, and whether they're going to reach out and confirm, I'm not sure, but they shouldn't need to be resubmitted.
Okay. The question is, what is the process for complaints from medical providers, drivers, and consumers?
So again, for any complaints regarding NEMT, if it is within the broker service area, we would advise them to go through the complaint process that's outlined by Telluride. There is, just to clarify, the broker has no vested interest in not resolving complaints. I know there has been some concerns out in the community that if the broker is handling the complaints, then that's kind of a conflict of interest. But again, the broker is not the provider. And so if there are transportation providers that are not doing their job and should not be in the network, the broker wants to address that as they're contractually obligated to. We also would be happy to handle any complaints, again, at the NEMT inbox, especially as we move into the new phases of this contract, to really make sure that we're getting the best start that we can and heading things off at the pass if providers, medical providers, or members believe that there are any issues.
Okay, great. And I think that's a good distinction between the two. So I think, Megan, you had submitted this earlier, and I'm glad you resubmitted so I don't have to scroll back. What kinds of quality measures will Intelleride be accountable to, and how often will they be required to report? Is there a way to get a copy of the contract?
So the contract is public. That's probably something I can get out to everyone. As far as quality assurance, we have numerous performance standards throughout the contract in terms of, making sure that there aren't no-shows, making sure that trips are actually completed, making sure that calls are answered on time, making sure that there's adequate call center staffing to handle any sort of overflow. So there are performance standards built into the contract, and we have the ability to reduce payments or deny until we feel that's remedied, as well as place a broker or a provider who's having trouble on a corrective action plan. As far as reports go, we will get reports as far as the volume of trips monthly, and we will get incident reports. So if the driver is involved in an accident with a member in the vehicle or something like that, we're supposed to get that within, I believe, 1 business day. I'm not positive on that timeline, but those things come right after they happen, whereas reports on usage and trip count and that kind of thing will come to us once a month.
Okay. So I think there was a question, and Stanley, we might need a little elaboration. I think the question is, what about how does the medical certificate of transportation services, if there's, Ryan and Mallory, you might have an idea of how that medical certificate of transportation services fits within the current benefit. And
so,
go ahead.
Yeah, so BAO is transferring all of their existing information to Intelleride. So members are still going to be required to have an MCTS on file in order to schedule transportation. So if that is not something that's already on file, that will still be a requirement of the benefit. But BAO is required, and we're working with them in Intelleride to make sure that the ones that are currently on file are being transitioned for already existing members in the system. Does that answer the question?
So Stanley, I'm going to just pop down at the bottom. If that answers the question, great. And if not, yes, great. Okay. I'm trying not to lose track here. Okay, great. So that seems like that hit that. And Katie, thank you for letting me know that my nose was cut off, or you can only see me from that. I should have probably read that earlier on. I apologize. I couldn't see my screen when I was doing this today. So I appreciate that. I should have read that earlier. So, so the question for Brian is, if one patient is eligible for Medicaid, and this is a non-emergent transport, who's allowed to accompany them? Family members and or friends who may not be Medicaid eligible?
So typically an escort is allowed. So that's usually the case when it's a child or an at-risk adult. So it's not always the case that somebody can go with them just because they're a family member or a friend. It typically is something that's medically required. And I know that leads to issues with childcare and that kind of thing, but it's something that typically needs to be approved so that our providers aren't, transporting a whole car full of people at any given time.
Okay. So the question then is, there's a question that says, currently some patients that have Medicare and Medicaid aren't eligible for aren't all eligible for transportation, but it sounds like that has changed. So Ryan and Mallory, there isn't any exclusion for people who are covered from at least Medicaid, correct?
No, anybody who has state plan Medicaid is eligible. If they have Medicare, depending on the circumstance, we may look at what, you know, the trip, or if it's a out-of-state type of transport, who is paying for what. But anybody who has state plan Medicaid is eligible.
Okay, that sounds good. Molly, I see your comment that you needed a little more clarity and completeness on answers. So if there's something specifically that you don't think has been addressed, I think you probably have a better indication of if the question's fully been completed. So if you have something specific, I would ask you to address that again, and we'll try to make sure that we dig into the specifics. And if we don't get that, then we would definitely have you all call directly and get some more detail if for some reason there's additional questions, but we will try to address as many as we absolutely can today. But it would be very helpful that if something hasn't been addressed to the level that you'd like, being very clear about what that is. Okay, what kind of training education do IntelliRide drivers have to be respectful and affirming of LGBTQ+ patients?
So that's not something that is specifically addressed in the contract. It is something that I could look into amending in the future. Currently, drivers and those who I believe work in the call center are required to undergo a number of different trainings, and I think the only one that would come close to touching on it would be cultural and disability sensitivity training, and I realize that that doesn't directly answer the question. So I guess what I would say is currently there's not a requirement, but that's something I could, you know, we'll look into adding in the future.
Okay. Go ahead.
This is Mallory, sorry. I just want to let you know that Zoom crashed on me, so I'm purely participating by phone. So we are deferring to you for questions.
Okay, that sounds great. What kind of training? Oh, okay, we got that. What is the estimated timeline for updated website and forms?
As far as our website goes,
Yes.
That should be done, I think, I want to say we decided on August 19th, so the date that the call center goes live. Aveo has updated all of their forms, or will be, I should say, sorry, starting Monday the 19th, just to include information about the transition. So anybody who goes to Aveo's website or downloads any of their forms or calls the 1-800 number will receive the information about the transition. So that's what's currently going out to members. We did a provider bulletin that should have gone out earlier this month about the transition. And again, our website, the department's website, is going to reflect the change on Monday.
And we're also currently in the process of approving all of IntelliRide's deliverables, so all of their forms, provider materials, call center scripts, all of those are going through us, and those will be, their website will be up same time as our call center. Yeah, so August 19th is the big day when everything will be available from IntelliRide, so members and providers can start confirming things for September, but their website and forms and everything are in the works.
Okay. So back to eligibility, not just about who is eligible, but what types of rides are eligible. Will the types of rides or circumstances of not having transportation in quotes are that qualified to receive a ride through EMT to clearly be listed somewhere? So it sounds like there's been some complaints from medical partners that trips were denied for patients, even they were the same as previous ride reasons. Subjective seems to be a bit subjective on the part of the broker. So are there any types of ride eligibility specific?
So those, I mean, not knowing the specific circumstances. I can't speak to exact cases, but the type of transportation is based on need. So again, that would be between the broker, the member, and the medical provider to determine what type of transportation is needed for the member.
Okay. But so there's no actual types of rides that are typically just outside of, if it's medical transport related, there's nothing that just completely is outside of that.
Again, it would depend. I mean, we authorize ambulatory or wheelchair vehicles or ambulance. It really depends. We could pull the list of types of transport in the contract, but it's, I mean, it would, again, depend on a case-by-case basis.
Okay. And so I don't know the acronym here. So do MCT forms, and then is that, do you know, Mallory and Ryan, can you tell us what MCT is?
So I believe it's the medical certification for transportation services. No, I don't have it in front of me, but it's the certification form that is required for a member to receive NEMT services through the broker.
Okay, so given this new, I think with the IntelliRide change and then the new benefit components, do these forms have to be resubmitted because that's not the same thing as already scheduled trips and standing orders?
Yeah, so this is what we talked about earlier. So all of the forms that Mayo has that are currently in the system will be transferred to IntelliRide. So members that have already gone through that process should be good to go to schedule rides with IntelliRide beginning 9/1.
Okay. So the question came back to the whole, and I'm sorry, I know everybody real time is entering questions based on questions previous, but back to the questions about family members who are coming with Medicaid patients. When it said, I think there was a note about approval. The question is who decides family members approved by who? So I think it's relevant to that specific question for the accompaniment question earlier.
Sure. So if a member needs an escort or a family member to go with them, it's up to them to notify the broker. Typically, if they have one escort and it's documented by the medical provider in their MCTS form, that should be fine. It's important to notify when scheduling the ride that the member has that individual accompanying them so that they can make sure there's adequate space in the vehicle. If a provider is multi-loading or giving other people rides that are Medicaid covered members, it's important just for them to be able to plan that in advance. Okay.
Are there standards for counties? It says there are multiple counties that they say they have no timeline for mileage lodging reimbursement, which basically means that families don't get reimbursed for months. Then our facility has to use our own funds to provide gas cards to ensure care. Is that allowed?
We don't oversee the county administration. I know that members have a certain amount of time to get the receipts in, and how that is processed is up to the counties until the statewide brokerage. And if a medical facility chooses to reimburse them in their own way in the meantime, that's up to the county and the medical facility.
Okay. So there's a question that says, I have heard that Teller and Park counties are not considered rural counties in dealing with the Medicaid NEMT transportation. Does Bennett being rural make a difference? I think that's the question.
No. The counties are able to administer the benefit through their administrative funding. And again, outside of the broker area, we don't have oversight of that until the statewide broker model. And even if a county were defined as rural or not, it still has the authority to administer the benefit.
Okay. Here's a question that says that if you know what is there available for patients who do qualify for NEMT transportation, in terms of looking at oversized wheelchairs in rural area. Do you know anything about capacity to help people with oversized wheelchairs and other probably special equipment?
Not off the top of my head. If you want to follow up via NEMT inbox with some specifics, we will be able to reach out to the county and see what might be available.
Beautiful. Okay, sounds good. So is there, and I just have to give a shout out to my Eastern Colorado hometown folks. I see a couple of people who are on from my stomping grounds. So hello, Eastern Colorado. Betsy, Shar, I saw a couple of folks. There might be a few as well. Always love to see questions about rural Colorado coming through. Is there a list of qualifying diagnoses for NEMT rides?
Anybody with state plan Medicaid is eligible for NEMT.
Okay. What exactly does Medicaid require to reimburse for travel, mileage, and lodging? What are their standards? And I think, Mallory, you and Ryan had said, is this something that you are or aren't responsible under this specific group or this specific area?
So it depends. Medicaid has our rate schedule, which I can send you the links to in following up from this webinar. So those rates are what we can reimburse up to. And then it's the responsibility of the member to submit those receipts either to the county or to the broker, depending on their location. And that rate schedule outlines what we're able to reimburse up to for meals, lodging, and mileage if a member does have somebody drive them to their appointment. And that's an option under NEMT.
Okay, and I'm going to read the rest of this, I think, which then helps inform, because every place requires something different. Some will fax out forms, some will require the family to go in person. Some say the PCP has to fill out whatever form they use. Some will allow Medicaid specialists to fill out. Some require a letter with letterhead. When pressed for why they require these things, they say that Medicaid requires, but that doesn't seem to make sense because they all are very different, and this is brokers and counties and the DHS offices. So it sounds like there's a little inconsistency. Ryan and Mallory, do you want to respond to that?
Sure. We can dig into what the requirements are within our scope. Once again, unfortunately, until we have the statewide, excuse me, the statewide broker model, there are going to be inconsistencies, and that is what we're moving towards to remove and to have that oversight of, so that once we have the statewide broker model, we will be able to have oversight of that and streamline what the requirements are for the entire benefit. Okay,
that sounds good. So there's some questions then about how to access Teleride, and Mallory and Ryan, I think you've addressed some of the website, but then also the link that you had on the last slide is probably going to be the best resource. And I know that Brittany sent that out. We will be resending out the slides from today as well. And today's webinar will be recorded. So if there's any further information or we want to share this information, we sure can. Anything else that can talk to us about the access to Teleride that you want to share in addition?
I'm not sure what you mean.
It says, Ryan, please send us how to access the Teleride. So I think that's the link, right? You said at the last slide.
So I don't think it's in the slides. What I can do is I can send it to you to send out. You know, again, something to keep in mind is the website's not going to be up for a couple more days. They are also going to, I think, have the information available in the Peak Health app that the department uses, and I'll send out the number for the call center as well so that people have that. And I think for now those are going to be the only ways to get to them. And
as of Monday, that information will be on the department's external NEMT website as well, with the link once it's live, as well as the number for members to schedule transportation.
Okay, and I know Mallory and Ryan, you said that the timing of this webinar was really interesting because you guys were just getting ready to roll this out. So this is great because it's a sneak peek. So we will, and thanks Jan for your question. We will definitely send that out, and it sounds like it will be accessible on the website as well. The question then is, who can sign the MCTS forms?
So that form will be available on IntelliRise's website once it's live. For the meantime, it is still available on VEO's website, but that will be on IntelliRise's website where you can request transportation. There'll be a page for members as well as medical providers.
Okay. There's a question about mileage. Is there a mileage limitation? Specifically, this question gives people who live in like Firestone, Colorado, and who are trying to come to Denver Health. Is there a threshold for mileage reimbursement?
I do not believe so, but I do believe that for over 25 miles, there may be additional documentation required, just so there's information as to why that member has to go to a provider that distance, which happens a lot. And there are many reasons that could happen. It just may be a matter of providing that documentation.
Okay. And then back to that question about who can sign it. I think the who, and I think maybe Betsy, the question is, does it have to be a physician or does it have to be someone? And I think the who from those facilities might be part of the question about signing that form, just from earlier question. Brian or Mallory?
The MCTS form or the
yeah, the MCTS, yeah.
Yeah, so it would be a medical provider that would say where the member is going and why that trip is authorized.
Okay. And then there's questions about the contact information, which we're definitely getting to, and then we will send out. Does IntelliRide make outbound calls to patients for weather closings? Last year, VEO canceled several trips and said the facility canceled even though they were open.
Off the top of my head, I'm not sure whether that's contractually required. I would have to, and the contract's pretty long, so that's something I'd have to go back and dive into and then follow up on. I don't know that there is currently a requirement in place.
Yes, okay. And then the question here is, will there be a new 800 number for the new company, or does the old one transfer over?
It'll be the new one, and I will send that to you, Andrea, once we're done here, so that you can blast it out to the group.
Okay, that sounds great.
And that number will be effective as of Monday, August 19th.
Okay, great, sounds good. Can the 25-mile limit be removed? It's a huge barrier. Specialist appointments are generally at university campus where the transport is denied due to mileage. The patient can't reschedule a specialist due to mileage in private or prior appointment.
Again, I mean, these are kind of, getting into the case-by-case basis. And if there is a trip beyond 25 miles, it would be required to fill out that additional documentation. There may be the option for some type of standard order if the trips are reoccurring. But we probably would ask for that additional documentation even for specialty care.
Okay. Will there be a member survey conducted to understand the member experience?
Yes, I believe that the broker is required to do customer satisfaction surveys annually. So that will be upcoming within the broker service area. Outside of that, we do not have any plans to administer a survey, and at the department, since we're a team of 2 people currently, that's not something that we have the bandwidth to administer ourselves.
Okay. Question going back to the MTS and the provider type who can actually sign the form. So does it have to be an MD mid-level, or is it someone who is licensed like a social worker? Do you know that level of specificity?
I believe it can be anyone licensed who is familiar with the member's care and would be involved in authorizing the trip that would be able to verify the appointment.
Okay. Will we be able to book and edit trips online?
Yes. All of the details for those methods who can book transportation will be outlined on IntelliRide's website. I believe they also have a mobile app for individuals who have access to a smartphone. The smartphone will not be provided by Medicaid or Telluride, but if a member has that, that is also an option.
Okay. Let's see. How will members of the new NEMT board be selected? Who will select them, and where will information be about or posted about applying for these positions, for the board position?
That is something within the broker contract, and so those will be discussions once we have the new broker in place. We don't have information on that currently.
Okay. So the question back to the MCTS forms, can you also check the status of those forms online?
That I don't believe so. I believe you would have to call Telluride to make sure you have a form on file, or the member has a form on file.
Okay. Can patients schedule trips online? And I think previously you had said yes, correct? Or can the patient do it directly? Okay.
Yes.
Okay. So this one sounds like, will the online booking work? Because VAOs sure didn't work in the past.
Our assumption is that it will. That's why we're paying a broker to have a website. And if it does not, they're required to notify us if there are any technological issues, as well as with a timeline that will be resolved. If you're finding that anything on the website doesn't work, and you haven't heard about it from Telluride, please notify us as soon as possible, and we will reach out to the broker to get that resolved.
I will add on to that given Telluride being a subsidiary of a large company that's been doing this for a long time, I'm hopeful that they're bringing a little bit more to bear than BAO was able to. So I'm optimistic with the broker we went with, and I think that it's going to be a much better experience for all involved. So any concerns, please send them to us, but I am confident that it's going to be functional, just given their experience in this area.
Okay. Will patients who are not eligible for a taxi ride be provided with bus tokens?
If they have access to public transit and that makes the most sense for their needs, then that is something that Telluride will be providing.
Okay. And I think a note from Pam that having that email will be huge, that will help with resources in terms of fixing issues currently experienced. So I want to go back. There was one question specifically that I think I might have skipped over because I was trying to figure out the relevance, or not the relevance, but the connection, because I think it was a real-time submission to response, and I'm going to go back to that. So let me just ask quickly, Ryan, you had mentioned during the presentation about making the distinction between the NEMT in this specific benefit and then the voucher system. Can you explain the difference quickly?
Do you mean NMT that he mentioned for those on waivers?
Yeah, oh, excuse me, vouchers, yes, I meant waivers. Yes, that was my question.
Sure. So NMT, and unfortunately, Kathleen's not here. Our colleague oversees non-medical transport. The difference is that NEMT is for anyone on state plan and will take you only to and from covered services. NMT is for folks on HCBS waivers, and it allows them to access it doesn't have to be a covered service, basically. If somebody needs to go to the grocery store or something like that, under NMT, if they're on those HCBS waivers, that's something that they have access to up to I believe a certain number of units, versus NEMT, where it's anyone on state plan, not limited to those HCBS waivers, and it's only to and from those medical covered services. So non-medical transportation, the NMT, is just a little bit different in terms of where people are able to go.
Okay. The question is back to bus pass requirements. Are they going to continue to be the same, as in 7 days before the appointment? Is it possible for the CNs to receive some for patients who are walk-in and need a ride and have Medicaid?
That's something I can look into offhand. I'm not sure whether I'm able to get some in advance, and that's just because typically we pay the broker to authorize, check eligibility, and make sure that there's a authorization in place. I don't think anything changed around the timeline, but that's something I can look into contractually and follow back on.
Okay. And I want to just alert everybody, we have about 2 or 3 more minutes left, and we're going to wrap for today. So Ryan and Mallory, this has been fantastic. So plenty of time for questions. So after August 19th, can we schedule rides with IntelliRide directly for appointments after September 1st, or we don't start scheduling with them until September 1st and continue with VEO until then?
So that's that's a little confusing, I understand. So after 8/19, you can start scheduling with them with IntelliRide, that is, for anything September 1st and beyond. If it's something that's going to take place in August, you would still need to call VEO. But after the 19th, if the appointment's going to be in September or beyond, you can call IntelliRide.
Okay. Thanks for that clarification. What do you see as the differences between VEO and IntelliRide based on current information, Ryan and Mallory?
I mean, I think that will be told in the future. We can say that so far IntelliRide has been very collaborative. Their deliverables have been very high quality. They're very eager to start work in Colorado. You know, again, they were the only company that bid on the RFP, and based on their proposal, you know, we really are putting faith in them to do good work. And through the RFP process and the new contract, we really did add some additional quality measures and ways to increase the oversight, because we understand that with VEO, there were some concerns and there were some difficulties that we witnessed as well. So we really are believing that this will be a better process, and we are willing to work with them as well as work with all of you to make sure that it is. And if there are any concerns, we really want to address them as soon as possible instead of hearing about things that have snowballed and become bigger issues. So we really are looking forward to this transition. I think being new to the benefit and having a new vendor and a new contract, we're really hoping for a fresh start, and we appreciate the opportunity to speak with all of you and the opportunity to collaborate moving forward.
Great. And I think one of the questions more concretely is a contract the same as what VEO was issued, or are the deliverables different? And then are the eligibility, I think it says deliverables the same forms, eligibility, etc.
I mean, there have been some changes in the contract in terms of eligibility for the benefit. That remains the same, and IntelliRide will still have to confirm eligibility before approving trips. But again, you know, we really hope the changes in the contract will be positive ones.
And we did, based on our experience with VEO, we made sure to listen to feedback, and the RFP process, from what I understand, I came in after it, but my understanding is it was pretty collaborative, and there's a lot of changes that were made based on experience and the feedback we received. So the contract is not going to be identical to VEO's. There are some things that we, based on stakeholder feedback, on provider feedback, we hope that we have improved upon with the new contract. The list of changes is somewhat extensive, so offhand I can't write them off, but there were a number of changes we made to improve the experience.
Okay, so there are a couple of questions. We have time for 2 more that are patient related. Will rides be covered for wheelchair repair appointments, not in clinic, but repair shops?
That we would have to look into. I know we don't cover picking up durable medical equipment, but if it were a vendor that is a Medicaid covered service, I would hope so, but I would have to confirm that. If the provider were unable to go to the member's home to do the repair.
And there's some questions about the contract and the like, which it sounds like, Ryan, for posting of that new contract and what that looks like, that will be available on your website. I think you said previously, we can make sure to really outline all of these phone numbers for access, the new lines, questions about the contract and the like, and we could distribute that as well. On the final question was ultimately also for medication pickup related to using the benefit. Can patients use IntelliRide to schedule trips to pick up medication?
At this time, that would not be a covered service under NEMT. It might be available if the member is on a waiver for NMT, but because of where many pharmacies are located, currently that's not something that's included in the benefit.
Okay. So I want to say thank you. I know Ryan and Mallory both at the top of the hour have to, I know that we had to actually stop at 2 o'clock. Ryan, Mallory, thank you so much. I think the timing couldn't have been better for hosting this webinar about the Medicaid transport and all of the new changes in the resources. And I would just ask everyone today, we will be continuing to host discussions about barrier reduction around specific basic needs, so food, housing. If there's any other topics, because today's webinar was actually brought up and the need based on the last webinar about transportation approaches. So if there's anything else that's come up based on thinking through the transportation aspects, please email and respond to me, and I'd be happy to try to help facilitate further discussion. But Ryan and Mallory, thank you so much. I think probably in the coming 6 months, year, we'll probably circle back with you all to understand if there's any changes, how things are working, and probably maybe in the next year have you represent about what the experience is now that your contract is getting underway. So thank you so much. We really appreciate everything.
Thank you. We appreciate it.
Great. And everyone, stay abreast of the next, I think we'll be hosting the discussion around housing likely in October. So I know there's some great resources out right now. Colorado Health Foundation, several other advocacy groups are doing a lot around housing and shelter in Colorado. We will be focusing on direct needs and thinking about how do care coordinators, medical teams, and people who are helping navigate vulnerable populations really access direct services and real resources for housing. So we're going to be hosting that again probably in early October, and we'll have some specific discussion around those with chronic disease and specifically cancer, as we will be focusing on work with the Colorado Cancer Coalition in that one webinar in October. So stay tuned for that, and thanks again, everyone. Great turnout. We're averaging at about 100 folks every session. So have a great afternoon. Thanks for joining, and Ryan and Mallory, thanks for sending along information, and we'll pass that out to receive that in the week. So have a great day, everybody. Thank you for joining.